oncologists, yes, we have medicines. Yes, we can treat. Yes, we can reverse some things and we can help take pain away and we can help do things. One thing we have to all do better as a profession is bringing the patient to the table, because no one knows themselves better than themselves, and no one knows what they're going through better than themselves. If you don't listen to them and really hear what they're saying, then you're setting your own self up for treatment failure.
Welcome to Health Unabashed, the show that is unapologetically passionate about innovation as a catalyst for improving care. Hosted by digital health advocate, influencer, and author Gil Bash, the show looks at the thought-provoking ideas, people, and companies who are making a difference. I'm your co-host, Greg Masters, and I'll be joining Gil as he and his guests share opinions and best practices on how to connect the dots to create sustainable change. Learn more about the show on the program page at healthcarenowradio.com. Now let's hear from Gil on what's in store for today's episode.
I was particularly eager to have you on today for a number of reasons. One, you, Dr. Ocean, and we're going to talk about you and what you're doing and what you stand for. And then the other aspect is that was so vital is you have really rewritten the rules on the physician-patient relationship in many cases where physicians are empathic. They don't necessarily see their patient as a partner in the whole conversation of health. You most certainly did. And then equally important, you understood that to change the dynamic of a condition like pancreatic cancer, we really had to break the rules because the rules were not working for anybody. This month is Pancreatic Cancer Awareness Month. You're one of the founders of Let's Win for Pancreatic Cancer. Congratulations on a successful event last night. It's also a very special day because it's the birthday of Ann Glauber, your partner, who was also your friend, continues to be a friend in your heart, and was your co-creator of Let's Win for Pancreatic Cancer. When Ann was diagnosed with pancreatic cancer, she asked the question, now what? And she decided to turn her life and her health struggle into a social movement. And she turned to her partner, her physician, Dr. Allyson Ocean, and said, will you help me? And the two of them with other people, Cindy Gavin, Lustgarten Foundation, other wonderful people, rallied to create Let's Win for Pancreatic Cancer. By the way, you can find Let's Win for Pancreatic Cancer online, letswinforpancreaticcancer.org. It's a very important organization. It's an important resource. So it's an auspicious day that we have you on the program. We're going to talk about a lot of things. But Allyson, I wanted to right off the bat say it's a great privilege to have you here. For people who don't know Dr. Ocean, who are joining us today, Dr. Ocean is a physician associated with Weill Cornell. She's a leader there. She is trained as a gastroenterologist with a specialty in oncology. Obviously, she's become world-renowned in the area of pancreatic cancer and passionate about the cause. You've worked with people with a variety of different cancers, colon cancer, of course, other cancers, but we'll bring it all in. I wanted to ask you, historically, the relationship between doctor and patient has been sort of like, I'll say paternal, maternal, and sort of like, I'm doctor, you're patient. And I had the privilege of seeing you and Ann while Ann was diagnosed, yet healthy. You were shoulder to shoulder as partners, whether it was partners at the White House with the Biden Cancer Moonshot Initiative, whether it was in the offices of Jimmy Carter doing his PSA when he was diagnosed with pancreatic cancer and other cancers. You have seen the patient as a partner, and I wanted to get your perspective. Why? Why are you so different than other physicians who sort of see them as people, important, and I got to do stuff on them?
Well, let me just say, Gil, that it is my honor to be on with you and Greg. This is such a special time, and I just thank you so much for having me. When Ann came to me, just getting diagnosed with stage 4 pancreatic cancer by her dermatologist because her eyes were yellow, and came to me after going to a few doctors who were very negative, or said, "Oh, I'm so sorry, you're going to die soon. Get your affairs in order. We can't help you. One treatment is worse than the next." And those were the messages that she was getting. And she, as you know, a executive, high, the best in her field in PR, and she said the message has to change. What the medical community is telling patients is wrong. How do you expect to do well if you get nothing but a sentiment of resignation from day one? How do you expect to do well? And I really took that to heart. I'm not a negative person. I'm built. I mean, positivity is one of my strongest traits. I know that. But I heard that message and I said, you are so right. How do you know that you're going to be in that statistic that is so bad? We don't know. No one knows. So why believe that? And I just made sure that Anne's voice carried through everything I did. And that one thing led to the next. And she had this brilliant idea that we need to change the conversation about pancreatic cancer. And she did. And Let's Win is her legacy. And to be an oncologist, yes, we have medicines. Yes, we can treat. Yes, we can reverse some things and we can help take pain away and we can help do things. But one thing we have to all do better about as a profession is bringing the patient to the table, because we learn no one knows themselves better than themselves, and no one knows what they're going through better than themselves. If you don't listen to them and really, really hear what they're saying, then you're setting your own self up for treatment failure because of that.
That's so unique, Alice, and that's so unique. I often have heard through my decades of experience in the industry, we should invite the patient to the table, and the reality is, it's their table, right? I mean, we all exist to help sustain and save their lives. You saw that in a very unique way, and I just want to say that a lot of doctors sometimes, and I don't want to generalize, they're frightened about losing their patients to some extent. When a patient moves to another physician, they take it personally. They're people, right? They're people. Yet you established, well, an online form of crowdsourcing between patients and patients and patients and doctors and doctors and doctors to develop invitations to participate in clinical trials. In effect, before we were talking about decentralized clinical trials, you were pioneering decentralized clinical trials in pancreatic cancer. And I do know that your efforts have produced results. I do know from following you that the life expectancy of people with pancreatic cancer now has extended from 1 year or less to 3 years. And I wanted to ask you, what's the combination of, whether it's digital health tools or different perspectives or relationships or medications or experimental trials or whatever, what's making that possible in such a short time? That's Anne's birthday gift to us on this special day, right? She started this with you and others. It became a movement. That was Anne's thing. Let's create a movement of change, social impact. And you dived in with her shoulder to shoulder. You went wherever you needed to go, fly wherever you needed to fly. And I hear 3 year survival rate. And when I hear 3 year survival rate, am I dreaming about 5 year survival rate? Is that going to be possible?
When we first started Let's Win, we were worried that we were not going to have enough content to show enough survivors. We were worried that every 3 days is what our goal was to put out content and stories. Anne's story was the first story. And everything about Anne's treatment was science driven and cutting edge and based off of clinical trials. And she took the lead in her care. And now we have featured close to 50 unique stories of stage 4 pancreatic cancer survivors living more than 5 years, stage 4. And that, someone would say 40, but think about we only hear the negative stories. We don't hear the good stories. That's the problem. There are so many good stories out there. We just don't know about them. So I don't believe those statistics that they're all so bad and you're going to die so soon. I think there are a lot of people that are survivors that we do not hear about.
That's such an important aspect of encouragement, the support. I'd be curious to know, has the research-based industry sort of leaned into this and realized that Let's Win and the mission of Let's Win, which is basically to get people into innovative trials sooner to sustain and save life. Have they taken notice? Are they open-minded participants? Have you had to drag them to the table, or are they knocking on the door?
It's a process. In the beginning, it was like, oh, this is exciting. What is this? This is a new platform it's just a website. But we didn't want it to be just a website. We wanted it to be a method, like you said, of driving action to drive people to therapies, into clinical trials, into better therapies that exist today. And over time, we're now 5 years old, and it has become that. It has been a go-to resource for that, and it's gotten a lot more acceptance than initially. The one thing that I deal with all the time, and I think that every oncologist who practices at an academic medical center feels, is that we do have limitations as to how out of the box we can go. We all signed and pledged the Hippocratic Oath, do no harm. And of course we practice in that way. But taking care of a patient with pancreatic cancer whose life is on the line requires risk taking. And risk taking is not something that you can do over many months. You have to make quick decisions, and the risks and benefits of these decisions have to be discussed honestly and openly with the patient. If it's an off-label drug, you have to tell them what the risks are, but you also have to tell them what the potential benefits are. And we do get a lot of pushback. And I understand that. I get that. There are rules and there are frameworks there, and we have to put safety first. But what bothers me the most, and what I'm trying to change in how doctors practice, is that think about the person in front of you and forget about all these extra rules and these, quote, standard of care, we have to practice this way, guidelines. And think about the person in front of you, because the person in front of you is not a guideline, is not one patient in a trial, and what is really best for that patient.
I've got to jump in, and the standard of care in pancreatic cancer, and serious cancers like pancreatic cancer, where some doctors religiously say, look, we're going to follow the standard of care. We're experts at this and so forth. Don't we kind of know those are death sentences? I mean, we know where they're going to end up. Standard of care doesn't have a very long runway, does it?
It doesn't.
And it doesn't advance our knowledge of what alternatives exist. I see this constantly where people are almost lured into the standard of care. And what you've just said is, and I know Greg, I could see from we're audio, but we're right now visual. I could see Greg's physical reaction to it. We doctors have to learn from you, which is, Hippocratic Oath, absolutely, but do no harm. Sometimes doing what we know can be more harmful than exploring the territory that we must venture into in order to sustain lives. And even in this COVID-19 era, I have many friends who participated in the clinical trials. Those early in on the clinical trials recognized the status quo of society was not going to work. We cannot remain in our caves forever, and we needed to invent different vaccines. And lo and behold, because we marshaled this collaborative energy of society, we're coming out the other end. You could have your family together. We're looking forward to having, in a season of holidays, families together once again. So I'm going to go back to this, and ask you, in terms of speaking to patients as partners in their care. ultimately, what it sounds like you're doing is you're dedicating more than the allotted 9 minutes of time per patient to explain to a patient what the opportunities and options are, and sitting there patiently with them and often their caregivers, their family members, to come to a shared decision.
What you said is perfect, is spot on. We get 15 minutes for a visit, and I've never done a visit in 15 minutes, ever. Established, new patient, whatever. We need time. We don't have the time. I'm always running late. That's my biggest, my Google reviews are, she's worth the wait, but it's a wait, and, guilty. Okay. But, but that's, you need the time to be able to do this for people. It takes a lot of time, and a lot of people don't have the resources or the support from their own institutions to provide this time. They have to, it's like a factory. They have to see a lot of patients in a certain amount of time, and RVUs and this and that. And so they don't have the time. And it's sad, because what we need is a collaborative, comprehensive team taking care of someone that approaches it from all angles. It's not just one person. It's not just me. I rely on the geneticists, the surgeons, the gastroenterologists, the nutritionists, everybody. And we're a team doing this, and we all need this extra time. We don't have it, but we have to carve it out as much as we can. It's so many changes have to happen, and it's little by little, we are seeing breakthroughs, I think, in terms of being able to bring the patient to the forefront and really have a say in, have them have a say in what goes with their treatment. I think this really applies in the realm of palliative care too, actually, because just as many people who want treatment, there are people that don't want treatment after knowing, what's involved. And we have to respect those wishes and also understand them and accept them. It's hard for me as an oncologist when I meet a patient that says, thank you, but no thank you. I'm not interested. I don't want any therapy. And, I have to kind of figure out where they're at, why they're saying this. Maybe they had a relative that went through it and had a bad experience. Maybe they just want to spend the rest of their time, however long it is, on an island in Maui somewhere. But, I don't know, but we have to take the time to counsel people to get the best treatments, and to counsel people to get no treatment and to get palliative care as well.
That's very bold and very courageous, Noah. I meet a lot of physicians all around the world, super experts at what they do. I mean, renowned. Many of them I have found they're really enchanted with doing things. The sense of there's a person in front of me or next to me is secondary to I'm going to do this operation. I'm going to prescribe this therapy. You have a unique appreciation for the fact that we serve humanity, we serve people, and I would be curious to know how did you get there? Because it's not. There are many physicians like you, thankfully, but sadly, there are many physicians who are not like you. So what tilted you toward the I serve humanity as a physician, as opposed to I perfect and offer you a skill, an insight, a diagnostic ability second to none? And then I'm going to give you a part B to this tough question. The other part B is, do you feel at the end of the day, when we look at clinical research and outcomes, is it possible that one produces a better outcome than the other approach?
Wow. Okay. The first question, I have to say that I got a lot of my inspiration and my drive from my father, who is a retired general surgeon. And people, stereotype surgeons as, 1, 2, 3, do the operation, no time for you kind of doctors. That wasn't my dad. And that's how I think I learned. He always told me to listen to the patient. Listen, because if you didn't listen, if you didn't examine and you didn't listen, that it was going to come back to haunt you. He taught me that from the very beginning. And that stuck with me. And I listen. You have to be a listener here. You have to really, it's not your agenda. It's not. And I thank my father for instilling those important words in me and values in me. Everyone wants to help people. We're all in the health profession. We're all doing this to help people. So, and there are so many wonderful physicians out there. What drove me to doing this as a profession that I wanted to really perfect, I think, is the fact that as I do this, I get to form the best relationships with my patients for a long period of time. And even if it's a short period of time because they don't live long, it's a long period of time because of the depth of our relationships. We are able, and we have the privilege of having such deep relationships with patients who are going through cancer. And that, I think, is maybe what makes me a little different than other people, or makes me is the reason why I chose this. Forget how you frame the question.
No, I think that's very true. I know that your relationship with Anne's children continues, and they have a tremendous connection to you, that they saw you more than a physician. I would say almost like an aunt of sorts. The relationship, I watched it sort of from across the room, and I was so impressed of how you gave of yourself beyond being a physician. So, there's a tendency, I think, for people to say, well, that communications thing, okay, when I speak to the patient, that's communication, but, the outcome is the outcome. You said something just now that I think influences the outcome, which is you're dealing with, in many cases, people who have very serious life-threatening cancers. Their runway is perhaps determined by the progression of illness. Is the outcome, sometimes we view outcomes in terms of survival or successful recovery or daily living ability. Is the case of the field that you're really a world-class expert in, is maybe the outcome peace of mind, comfort, confidence, reduced anxiety, increased connectivity, hope? Is that an under-recognized outcome in medicine?
Gil, I think you said it perfectly. I think it is an under-recognized endpoint. It's hard to make that an endpoint of a clinical trial. How do you make hope an endpoint on a clinical trial? How do you can do quality of life. There are quality of life endpoints. Sometimes the answer to solving a problem or making someone better is not because you made them live longer. It's because you made them feel better. We can't cure everybody. We cannot, unfortunately, yet, but we can definitely do our best to make people feel better. And we can never underestimate the power of quality of life, because why live if you don't have quality of life? So we have to think about all of these decisions, medical decisions, and how it affects someone's quality of life. And so I think that as we advance in medicine, outcomes such as quality of life will become more primary endpoints in trials rather than overall survival.
I've been speaking with Dr. Allyson Ocean of Weill Cornell, an outstanding physician, world-class, champion of patient advocacy, really one of the pioneers in decentralized clinical trials. She doesn't realize it, of course, but when she created her open source platform to invite patients to participate in exploring the world of what trials are available in pancreatic cancer, she really changed the rules of care. Dr. Ocean is a physician who goes above and beyond what would be expected. She connects to her patients as allies in their treatment, and as a result of that, she really wins over their hearts. I've seen it personally. I've had the privilege of recommending people to see Dr. Ocean, and they all consistently come back and say it was probably one of the most important introductions of their lives. Dr. Ocean, it has been a privilege to have you on this special day, Ann Glauber's birthday, Pancreatic Awareness Month. your exceptional work with Let's Win for Pancreatic Cancer and at Weill Cornell. I hope to have you back on the program again. Be well.
Thank you so much, Gil. This has been amazing. Thank you.
And that's a wrap for today. We want to thank our listeners for taking the time to tune in. You can learn more about Health Unabashed on the program page at healthcarenowradio.com. And keep the conversation going with Gil and me on Twitter by connecting with us via @Gil_Bash and @GregMastersMPH. And do tag your tweets with the hashtag HealthUnabashed. Until next time, stay unapologetically passionate about improving health.